welcome back to the Billing Buzz. Today in video number 3, we're going to be looking at some LCDs specifically for diagnosis-specific codes. A lot of times at CBS, we get a call or a question saying, how do I know Medicare is going to cover my procedure code with this diagnosis? And the answer is not every HCPCS code is a diagnosis-specific code, which means coverage is dependent on which diagnosis you bill with. However, some codes in the HCPCS system are diagnosis-specific, and a lot of times it's the lower extremity orthoses. So in today's video, we're going to talk about how to find them. First, we're going to start at cgsmedicare.com and select the jurisdiction. Then we're going to go down to our local coverage determinations and find the LCD we're looking for. In this case, I want to look at the knee orthoses LCD because that one has a lot of diagnosis-specific codes. When looking for whether or not a procedure is covered with a certain diagnosis, we're not going to go to our LCD, but we're actually going to go look in the policy article. That's where you're going to find this information. So click the hyperlink for the policy article. Once there, you have one of two ways of getting to your group tables, as they're called, for the diagnosis code. You can scroll all the way down until you get to them, and then locate the code that you're looking for at the top. Or, my preferred method is to go to your keyboard, hit the Control button with the F key, and you're going to get this Finder window up in the right-hand side of your browser. Could be the left-hand side, depending on the browser you're using, but it's going to be at the top regardless. Type in the code that you're looking for. In this case, we'll use L1832. And the browser will show you how many matches. In this case, we have 7. It will show you highlighted where each one shows up. So you can either hit the Enter key or use the arrows to navigate your way through each finding until eventually you get to your group codes. Once here, you're going to go to your search bar. And let's see if our diagnosis is covered. If it comes up, it is a covered code, and you will be able to bill the procedure with that diagnosis for coverage. If you type in a code and it does not come up, it is not a covered code with that procedure. If you bill the L1832 with the diagnosis for contracture, you will not be reimbursed and it will not be covered. So make sure that if it doesn't show up, you reassess your coding. And that's it. That's how to find a diagnosis-specific code in an LCD. As always, I hope you enjoyed. I hope you learned something. And if you have any questions, please reach out to anybody here at CBS. Thanks for tuning in and have a great day.